Hello guys, some more questions again. Okay, a nurse performs a home visit on a client who is delivered 2 days ago, and the client states that she is bottle feeding her infant. So the nurse notes that white curd-like patches on newborn's oral mucous membrane. The nurse should take which of the following actions? First is determine the newborn's blood glucose level. Second action suggests that the newborn's formula be changed. Third is remind the caregiver not let the infant sleep with the bottle. Fourth is explain that the newborn will need to receive some medication. So let's go to the rationale for this one. This one is the correct option is explain that the newborn will need to receive some medication. That is a correct option because the bottle feeding babies due to maybe the poor hygiene or the infection from the vaginal birth or those things, there is a contamination, there is a chance of the baby getting oral thrush. So the most of the oral thrush are required a treatment. So explain that the newborn will need to receive some medication. That's the correct option. Thrush most often treated with a nystatin, mycostatin or nystatin. Okay, so that is the correct option there. Why the other three options are wrong? Determine the blood sugar, thrush and blood glucose is nothing to relate. So the poor hand hygiene or exposure to an infected vagina during birth could be the cause. Okay, then the same formula, no need to change. It's not related to oral thrush. And not, again, caregiver not taking the bottle to bed, that also not related to this situation. Question number next one. The nurse at the birthing facility is caring for a primigravida woman in labor who is 4 cm dilated and 25% effaced and whose fetal vertex is at +1 station. The physician informs the client that the amniotomy is to be performed. The client states, my friend's baby died when the umbilical cord came out, when her water broke. I don't want you to do that to me. Which of the following response by the nurse is best? Okay, so let's see. First response is if you are that concerned, you should refuse the procedure. Second option is the procedure will help your labor go faster. Third option that shouldn't happen to you because the baby's head is engaged. Fourth option is we will monitor you carefully to prevent cord collapse. So these options, the correct option is that shouldn't happen to you because the baby's head is engaged. There is a third option. Umbilical cord prolapse usually occurs when the presenting part is not engaged or high presenting part. With that, when the rupture, it comes out with the fluid. Okay, so that time the cord prolapse happens. So if the head is well applied to the cervix and the head is engaged, remote chance is to have cord prolapse. So the first option, why? If you are that concerned, you should refuse the procedure, giving advice. This is non-therapeutic approach. Okay. Second one, the procedure will help your labor go fast. Doesn't respond to client's concern. Client concern is that when you do rupture membrane, so she is not looking forward to have a faster delivery. She is concerned that if her cord prolapse, the baby will die. Okay, so each and every point you have to focus. What is the patient concerned, not what you assume. Okay, what do you think? You have directly you have to answer the patient concern or what the question. What are the patient's question? That shouldn't happen to you. That we already said that is correct. Then the fourth one, we will monitor you carefully to prevent cord prolapse. Monitoring will not prevent prolapse cord. Okay, if it is going to happen, it's going to happen with the situations. Close monitoring or whatever it is going to happen, but intervention may happen means immediately. If close monitoring, you will monitor the baby's heart rate is dropping, or you will see loop of cord sudden action taken place and taken for cesarean section or imminent delivery. Okay. So let's go to next question. A primigravida woman comes to the clinic to her initial prenatal visit. She is at 32 weeks gestation and says that she has just moved from out of state. The client says that she has had periodic headaches during her pregnancy and that she is continually bumping into things. The nurse notes numerous bruises in various stages of healing around the client's breast and abdomen. Vital signs are BP 120 by 80, pulse 72, respiration 18, and fetal heart rate is 142. Which of the following response by the nurse is best? So okay, when you see like that patient, so definitely you can make out this patient is lying. Yeah. So she's trying to hide something, and there is evidence that the patient is abused, or there is evidence that there is trauma in her body. So you have to first concern about her safety and security. Okay. So the first question, what is the nurse best? Are you battered by your partner? First question you will ask. Second is, how do you feel about being pregnant? Third is, tell me about your headaches. You may be more clumsy due to your size. So you have to straight away, so you have to talk assertively and straight away ask the patient, are you being battered? Are you abused by your partner? Okay, that is the first question. Are you battered by your partner? Correct. Evidence of injury should be investigated. Assess head, neck, chest, abdomen, breast, upper extremities, all over body, and if require means, and you have to take this seriously and report it, and patient safety is a great concern here. Okay, and the other everything comes after that. How is the feeling of her pregnancy, and yes, all take priority. Injuries take priority to all other stuff, like her headache, her feeling towards the pregnancy, and clumsy due to your size. All those things are not important at this point. Safety of the patient is important, so you have to focus on that. So the next question is, the nurse is teaching a class on natural family planning. Which of the following statement by a client indicate that teaching has been successful? So let's go to the options. First is, when I ovulate, my basal body temperature will be elevated for 2 days and then will decrease. Then the second one, my cervical mucosa will be thick, cloudy, and sticky when I ovulate. Third is, because I am regular, I will be fertile about 14 days after beginning of my period. Fourth option is, when I ovulate, my cervix will feel firm. So let's see, in a natural way of family planning, what are things you are looking into. Okay, so when you are ovulating at the period of fertile, how you identify? So the first option is, when I ovulate, my basal body temperature will be elevated for 2 days and then will decrease. That is a patient statement. Okay, what happens is, in basal body temperature decreases prior to ovulation. It decreases prior to ovulation. Then after ovulation, temperature increases. Prior to ovulation, it is decreases. Then after the ovulation, it increases. So what is that? You monitor your temperature. There will be a slight decrease in your temperature, basal body temperature. Then it increases after the ovulation. Then cervix will become not thickish or cloudy and sticky. The ovulating cervix will be fertile. Mucus appears clear, thin and stretchy, watery and stretchy. Okay, that is the sign that ovulation is taking place. And the third sign is, ovulation occurs approximately 14 days. If you have a 28-day cycle, so approximately it is 14 days after the start of your menstrual period. Then the fourth option, why it is wrong? Cervical is, it was said that it is cervix is firm, feel firm. No, during ovulation cervix softens slightly during ovulation. Okay, so next one. A home care nurse plans care for a child in a leg cast for treatment of a fractured right angle. Fractured right angle, okay, and she's home care, not in the hospital setting. So nurse enters the following nursing diagnosis on the care plan: skin integrity. So she is writing the skin integrity, okay. Risk for impairment. So that is the thing she is expecting here in this right leg fracture, okay, right angle. So she's concerned about there's a possibility that skin integrity may risk here for impairment. Okay, which of the following action by the nurse is best? First is teaching the client how to perform isometric exercises of the right leg. Second option is teaching the mother to gently massage the client's right foot with emollient cream. Third option is instructing the mother to keep the leg cast clean and dry. Fourth option is teaching the mother how to turn and position the child. Let's see what is the correct option here. So the correct option is the teaching the child how to perform isometric exercises of the right leg. That is the correct option. Okay, contractions of muscle without moving joint promote venous stasis and circulation, prevents thrombi. Quadriceps setting, push back knees into bed and gluteal settings, and push heels into bed. So push with the that is how the isometric exercise is done, like how the right angle is fractured, no, right leg angle is fractured. So what he has to do is to push back the knee into the bed, the back of the knee into the bed, and the same push heels into the bed. This is how he can perform the isometric exercise. Okay, so then moving the joint promote moving the joints promote venous return and circulation. That is the purpose. Okay, then teaching the mother gently massage the child's right foot with the emollient cream will help prevent dryness of the foot and not address the skin under that cast. Okay, so then the third, instructing the mother to keep leg cast clean and dry, because the client is in a young child, should be included in teaching of cast care. Improving circulation is best way to prevent impaired skin integrity under the cast. And the fourth way is wrong. Teaching the mother how to turn and position the child, no information provided about the mobility. So because what she wrote about the skin integrity, so mobility was not mentioned in the care plan there. So no information provided about mobility of the child will prevent hazards of immobility. Okay, that is the answer for that. And the next question is, a nurse is caring for a client who had a thyroidectomy 12 hours ago for treatment of Graves' disease. 6 Graves' disease. The nurse would be most concerned if which of the following occurs. So 12 hours post-op thyroidectomy patient you are looking after, and you are see some of the things you are observing in the patient, and which one is your great concern. Okay, let's see. The client blood pressure is 138 by 82, pulse is 84, respiration 16, oral temperature 99 degree Fahrenheit. That's it. That is one option. Second is a client support his head and neck when turning his head to the right. Third option is a client spontaneously flexes his wrist when the blood pressure is obtained. Fourth is the client is drowsy and reports a sore throat. So here the first option, it's normal vital signs within normal. Yeah, 138 by 82, pulse 84, respiration is within normal. So there is no concern there. Second is client is supporting his neck. So that prevents stress on the incision. So the client support his head and neck when turning his head to the right, means he preventing stress on the incision. Then the third is the correct option. The client spontaneously flexes his wrist when the blood pressure is obtained. That is a correct option, because of it is showing that there is carpal spasm, indicates that hypocalcemia. So that is a concern. Okay, it's a post-op thyroidectomy, you are seeing a complication of thyroidectomy there, okay? It's a sign of hypocalcemia, okay? Then the client is drowsy and report that is normal after surgery. Okay, sore throat, that is normal after surgery, okay. Next, a client is admitted who reports severe pain in the right lower quadrant of the abdomen. To assist with the pain relief, the nurse should take which of the following, okay? Right lower quadrant of abdomen, okay? You have to focus on where because what is located there, you should have an idea in your mind that, okay? So first is encourage the client to change position frequently in bed. Second is massage the right lower quadrant of the abdomen. Third is apply warmth to the abdomen with the heating pad. Fourth is use comfortable comfort measures and pillow to position the client. So here, immediately as your right lower quadrant, lower abdominal quadrant means what comes in your mind? Maybe appendicitis, yeah? Appendicitis, if you frequently turn the position, what will happen? It may cause rupture, yeah? And the other thing is, if it is really appendicitis, your massage can cause also rupture, yeah? And the other, heat also can increase the blood circulation, and that can also cause a rupture. So the only option here what you have is option number 4. You can use some comfort measures like giving it measures to pillow to position the client. That is the right option. Rest all are wrong options, okay? 33. And then the nurse prepare a client for peritoneal dialysis. Which of the following action should the nurse take first? So peritoneal dialysis, okay? So the first option is assess for a bruit and a thrill. Bruit and a thrill for peritoneal dialysis? No, this is for hemodialysis, yeah, it's the fistula. The second is warm the dialysate fluid, a solution. Third option is position the client on the left side. Fourth is insert a Foley catheter. So let's see some of the things you can easily eliminate. Like, do you think a patient with peritoneal dialysis, so they can do ambulatory also, no? So you can go to washroom, so no need a Foley catheter. Position the client on a left side. Now this patient required a semi-Fowler's position or so let's go to what is read in the book, like assess for the bruit and thrill, that is used with hemodialysis through the AV fistula, graft or shunt. Second option is second option is the correct option. Warm the dialysate solution. Solution should be warmed to body temperature in warmer or with a heating pad. Don't use microwave, okay? Oven. Cold dialysate increases discomfort. If you are transfusing the dialysate you are using, it's as a cold, then it gives more, it increases discomfort for the patient. So then the next option, why it is wrong, the position the client on the left side. Client should be in a supine or a low Fowler's position, wearing a mask, okay? That is the requirement here for a patient on peritoneal dialysis. And the fourth one, insert a Foley catheter unnecessary, client can void without a catheter, okay? So next one. Oh, now this one is always a confusing question. The nurse teaches an elderly client with a right-sided weakness how to use a cane. Which of the following behavior by the client indicate that the teaching was effective? So the patient with the right-sided weakness and the patient is going to use cane. So you have to give instructions how to use the cane and coordinate the movement with the weak and strong side. So the weak side, right side is the weak sided here, okay? So let me go and read the rationale so that you don't get confused by reading other. So let me, information needed here, I'll just read it out for you. Cane tip should have a concentric rings, shock absorber or for stability. Flex elbow 30 degrees, elbow 30 degree, and hold handle up. Tip of cane should be 15 centimeter laterally to the base of the fifth toe. Hold cane in hand opposite affected extremity. This here, what is affected? It's a right affected. So in the left hand, the client has to hold on left hand. Then advance cane and affected leg. The first, what is first? Cane first, yeah, then affected leg. The left hand cane is there, then put the cane first, then the right leg. Okay, lean on cane, then the weak leg will go, and then it is the weight is on it, it's leaning onto the cane when moving. Good luck. Okay, so now the weight is on the cane and near left leg. Okay, so then good luck. To manage stairs, for the when you climb to the stairs, what happens? Step on good leg first. You go with the good leg, place the cane and affected leg on step. Okay, first good leg, then the cane, then the affected leg. Reverse when going down. So when you come down from the stairs, up with the good and down with the bad. So the bad, then cane, then the good. Same sequence used with the crutches also. So that is it, how it has to be. So here the person will use the cane will be on left hand, then at the right affected leg will go, then the good leg. Okay. Okay, I'll stop it here. I'll be coming with the other questions in next video. Thank you for watching.